Tamoxifen reduces breast cancer risk by blocking estrogen receptors, but has side effects like hot flashes, increased risk of blood clots, and a slightly higher chance of developing endometrial cancer. Can a lower dose keep the benefits while reducing the side effects? If you're under 50 years old with a moderate or high risk of developing breast cancer, this video is for you. Many women at high risk of breast cancer are looking for effective prevention methods that don't involve surgery. The general population risk for a lifetime chance of developing breast cancer is around 11%. Moderate risk means there's a lifetime chance of more than 17%, but less than 30%. High risk is 30% or higher. If you haven't already, you can speak to your doctor about formally assessing your breast cancer risk using the CanRisk tool, which looks at family history of breast and ovarian cancer, genetic information, lifestyle and hormonal factors, and clinical factors. Tamoxifen has been a cornerstone in breast cancer prevention for many women at high risk. But what exactly is tamoxifen, and how does it work to reduce breast cancer risk? Tamoxifen is a selective estrogen receptor modulator, or SERM, that works by blocking estrogen receptors in breast cells. Estrogen can promote the growth of breast cancer cells, so blocking its action helps reduce the risk of cancer developing. This mechanism of action makes tamoxifen an effective tool in reducing breast cancer risk for many women. According to a UK study, taking tamoxifen 20 milligrams daily for 5 years showed a significant reduction in breast cancer risk over 13 years of follow-up. A meta-analysis of several studies confirmed that tamoxifen reduced the relative incidence of breast cancer by 38%. However, it's important to note that while tamoxifen reduces the incidence of breast cancer, we don't yet know if it reduces the risk of dying from breast cancer, as none of the primary prevention trials were designed to detect differences in breast cancer mortality. Given the effectiveness of tamoxifen, researchers have been investigating if lower doses could still provide the same benefits. Can a lower dose of tamoxifen maintain its protective effects while reducing the side effects? Researchers are exploring the use of lower doses of tamoxifen to reduce side effects while still providing protection against breast cancer. In one study, taking just 5 milligrams of tamoxifen daily for 3 years was found to be as effective at preventing the recurrence of breast cancer as the standard 20 milligram dose taken for 5 years. Low-dose tamoxifen reduced the recurrence of breast cancer by 52% and the risk of contralateral breast cancer by 64%, with a favorable risk-to-benefit ratio. This promising research suggests that low-dose tamoxifen could be a viable option for those concerned about side effects. Understanding the side effects of tamoxifen is crucial for making an informed decision. How do the side effects of low-dose tamoxifen compare to the standard dose? For standard dose tamoxifen, 20 milligrams daily for 5 years, common side effects include hot flashes, increased risk of blood clots, and a slightly higher chance of developing endometrial cancer. Specifically, in a large trial, there were 99 cases of blood clots per 10,000 women taking tamoxifen compared to 70 in the placebo group, and 33 cases of endometrial cancer per 10,000 women compared to 14 in the placebo group. Other side effects include cataracts and a reduction in bone fractures. In contrast, low-dose tamoxifen, 5 milligrams daily for 3 years, shows fewer serious side effects. In a study of 500 women taking 5 milligrams daily for 3 years, there was 1 case of deep vein thrombosis and 1 case of endometrial cancer, comparable to the placebo group. Cataracts and other serious adverse events were not significantly different between the groups. Overall, while both doses effectively reduce breast cancer risk, low-dose tamoxifen has fewer and less severe side effects compared to the standard dose. Now that we understand the potential benefits and side effects of tamoxifen, it's important to take the next step in your breast cancer prevention journey. Speak to your doctor about a formal breast cancer risk assessment, and if tamoxifen is for you, ask about low-dose tamoxifen as an option and stay informed. By staying informed and discussing options with your doctor, you can take proactive steps towards reducing your breast cancer risk. Thanks for watching. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. Subscribe to our channel for more health tips and information. Stay healthy, and we'll see you in the next video.